Welcome. I'm Jess Frain, School Mental Health Consultant on the Student Services Prevention Wellness team here at DPI. And I am joined here today with my two colleagues, Liz Krubsack, School Mental Health Consultant, and Julian City, our School Social Work Consultant. And we're going to be giving you an overview of the newly released Wisconsin Comprehensive School Mental Health Framework, which is a recent update to our previous 2015 School Mental Health Framework. And the purpose of this tool is to present a vision for well-being for all students and staff in Wisconsin schools, and to establish a common approach to implementing a system for coordinating and delivering school mental health services. So as part of our Student Services Prevention and Wellness team at DPI, our vision is that in Wisconsin schools, everyone is and feels healthy, safe, supported, engaged, and challenged. And this means that each student has access to high quality public education, enrichment opportunities, and special education support. And this doesn't just mean having access to those tangible resources and services. It also means access to a school culture and environment that's safe and engaging. And in order for us to accomplish that, we aim to be intentional in our supports of student and staff mental health. And this kind of supportive environment that we're creating helps us to build the necessary foundation so that all students can graduate mentally healthy and ready for their next big steps. And it's also important to us to create a workplace environment where all of our staff also feel that supported, nurturing environment, and help them keep them connected to that sense of purpose that brought them into the field of education. So whether you're watching this individually or as a team, it's important to consider your own team's vision when you enter into this work, and consider how each piece of what your team is working on contributes to your overall vision. It's the why behind our work that keeps us connected. So the Wisconsin Institute for Public Policy and Service did a recent study called The Voices of Wisconsin Students. And this looked at how students are feeling currently from the COVID-19 experience, specifically related to their learning, coping, and resilience. And the results indicated a number of really positive things happening for them right now, including a greater sense of self-awareness, a deeper sense of gratitude for their family, friends, schools, and teachers. And they could also identify that they have a connection to at least one trusted adult. So these are all great, excellent protective factors and resiliency factors that our students are reporting right now. And then also on the contrary, these students are also reporting diminished social opportunities, losses of connections, and a lack of other healthy coping mechanisms. And that's kind of contributing to this high and increasing stress, anxiety, and depression. So knowing this information, what can schools do to both support those protective factors and help to fill in the gaps where the students are telling us that they're struggling? So when we start talking about this system of mental health coordination of services, when schools prioritize mental health, we find a number of positive results. We see better academic outcomes, increased access to mental health care, earlier intervention, better psychosocial outcomes, and an overall positive school climate and safety.
So we're going to spend the rest of our time going over 4 key points related to comprehensive school mental health systems. So the first one that we're going to start with is the idea that mental health includes well-being. So when we take a moment to consider the words mental health, what comes to mind when you hear that? What about school mental health? So when we talk about achieving our vision of wellness for all students and staff, we know that this really requires a shared understanding of what mental health is to begin with. And so we know mental health is often thought of as the opposite of mental illness. And a lot of times our school efforts focus around treating mental health challenges. But we know that mental health is more than that. So it's more than the absence of illness. It also includes high levels of well-being. So it's a state in which an individual can have positive emotions and moods, feels a sense of fulfillment and satisfaction with their life. They have the ability to cope with stressors, and they can be productive and contribute to the community in some way. So we know also that mental health is not a static state. It's very dynamic and fluid. And that healing and transformation and recovery from mental health challenges is not the exception, but really the norm. And so we want to frame our mental health work from this understanding of mental health as something that's changing. Now, we know also that social influencers of health can promote or hinder well-being. So these can be negative influencers, things like racism and discrimination, or experiencing chronic stress and trauma. But there are also positive influencers, things that make it more likely for someone to have positive mental health. So examples of that might be having access to mental health providers, graduating from high school, having food security. Those all can contribute to well-being. So we know that despite exposure to these adverse social influencers, everyone has different outcomes, and that really is because of resilience. We know that we can develop protective factors in students, and that's what we really want to focus on with our school mental health work. So we are going to take a minute now to hear from some Wisconsin educators, and they're going to talk to us a little bit about mental health and stigma. So why do we start by defining mental health here? Well, we know that, like I said, mental health in schools is often approached as a problem that needs to be solved rather than an asset that we can really work to develop. So something that contributes to that mindset is some misinformation about mental health and stigmatizing attitudes. And that can keep us from fully supporting students and staff in developing positive mental health. So here we're going to listen to these Wisconsin educators talk a little bit about stigma and how it shows up in their school.
I would think that, you're viewing someone in a negative way. Doing this could lead to discrimination, lack of empathy, possibly bullying if you're a student or an adult, I guess. But basically viewing somebody in a negative way and treating them differently because of that.
And it's about, also if I could add, about like a lack of knowledge or sort of an ignorance on what is going on, and that it makes people dealing with mental health issues feel uncomfortable and like they're not seen, or like they're not okay, and maybe that they want to hide out and go away from it all, so that they're not bullied or ridiculed in some way.
And when I think about stigma, I think about there are two different dynamics going on there. You have that public stigma where it's what other people are viewing and their assumptions and stereotypes and discriminatory practices they're putting on that person. But then you also have the internal or the self stigma and how they're thinking about themselves and their beliefs about themselves based on how other people are viewing and responding to them.
I would think too, lowered expectations, thinking maybe a young person that's suffering from being viewed in this way would feel ostracized, alone, unable to connect because of those views that they feel others that are looking at them in a certain way.
And then the challenge for us is to bring the education also to the students and the families in our community so we can erase the stigma and find strategies and therapies and things that are going to help and support us to be the best that we can.
Absolutely. It's up to the adults, I think, to lead the charge with education and advocacy. And without those supports, I think our children can be at a major disservice about, seeking out the care that they may need.
I can remember being a teacher before my district really made a push to educate staff members and students about mental health issues. And I can remember being a part of teams where some of my colleagues would view students that had some challenges and would wonder why administration wasn't doing anything about these kids. Why is this kid allowed to act like this? Really not seeing, I guess not knowing that the internal struggle that that student is having, versus now, I just see a total shift in the way we approach working with our young people that are struggling with mental health issues.
All right, so we just heard one of our educators speak about a perspective shift that was happening within his school around how people think about mental health and student behavior. So we're going to take a minute. You can pause this recording and consider what changes in attitudes, values, and beliefs are required to reduce stigma and advance mental health systems work in your community.
All right, so next we're going to look at point number 2 of the key points of a comprehensive school mental health system. And that is to really be thinking about how do we promote mental health in schools, and we do so using Wisconsin's mental health framework. So why a comprehensive school mental health system? What is it? Well, it's a full array of mental health services and supports, and it promotes positive school climate, social and emotional learning, mental health and well-being, and it reduces the prevalence and severity of mental illness. So this is what it looks like, Wisconsin's comprehensive school mental health framework. It has 6 components. You see them here: the continuum of mental health supports, collaboration, needs assessment and resource mapping, mental health referral pathways, sustainability, and data. And really, it's the continuum of mental health supports that we want to make as robust as possible to serve all of the needs and for all of the students and staff in our buildings, as well as to be thinking about what can we put in place universally and proactively to really leverage mental health as an asset in our school community. We also know that we can leverage what we already have in our systems, like in our multi-level system of support around academics and behavior, and we can use that to build in these mental health components to really support school mental health. We also know that our comprehensive school mental health should be infused with a trauma-sensitive lens, just like all of the aspects of our school system, all of our policies and procedures and practices infused with that trauma-sensitive lens. So this framework provides a vision for Wisconsin, sort of an ideal picture of what this can look like. And, we want to help with aligning our work and aligning our messaging so that everyone in the school community has a shared understanding of what this work looks like. When there's a shared understanding, there can be a shared commitment to the work, and that shared commitment can lead to shared responsibility. So this provides the vision for that work and helps with the messaging piece. And then it provides ideas, starts to point you towards different implementation tools. And DPI already has a number of amazing implementation tools out there, like our screening guides and our mental health literacy units and other things. And we're going to continue to build those pieces of implementation support as we go. So let's look at this first component of collaboration. As I was talking about, it's so important in collaboration to start with that shared understanding so you can get that shared commitment from everyone, right? This is not just the work of a few professionals in the school district. School mental health is the responsibility of everyone. And we want to really help everyone see how they can contribute positively towards this work. What is someone's role? What role does our out of school time providers have? Our students, our parents, our community members and our community agencies, our board members, our district administrators and principals, everyone has a role to play here. We also know that collaboration is enhanced when we have both multidisciplinary school and district level teams working on this, and that their visions are aligned and that all supports the district's strategic planning and big picture goals. And we know that collaboration is done most effectively when teams are using data-based student-informed decision-making and planning, really getting that student voice, understanding not only what we think might be good for kids, but hearing from them on their perspective. We also know that with collaboration, we want to be looking at our processes for how we're meeting, making sure we're just using agendas and starting and ending meetings on time and using those good processes, making sure all of the different work in the building in the district, so with our different committees, that all of those groups are talking with each other so that there is that coherence and alignment happening in our district. So one tool, there are many, one tool that we want to share with you today is the Culturally Responsive Problem Solving Guide created at DPI in partnership with Dr. Marquita Newell. And this is relying on current research to outline strategies that you can use to ensure you're taking a strength-based approach to accurately identifying a problem that will lead to an effective solution, right? This really helps walk us through what are the different strengths that folks are bringing into this team and that are bringing to the table in these discussions, what kind of perspectives are here at the table, and which perspectives might be missing. And what are some other considerations related to being more culturally responsive in the work that we're doing? So DPI not only has this guide, but additional supportive materials like online module and recorded webcasts. So how about needs assessment and resource mapping? So these two things go hand in hand. They're complementary processes that inform the comprehensive school mental health system. We want to make sure that as we're going through these processes of identifying our gaps and needs, that we're also really looking for our strengths and our resilience, and we're holding up a mirror to our individuals to show them all of their strengths and assets that they bring to the table, making sure that they are understanding all of the wonderful things that they bring, also looking for the strengths in our system and how can we leverage those strengths to help us better meet our needs. And we're going to be looking at how teams can better identify, represent, and share resource information through a resource map. And that could be a physical sort of map looking diagram of your school community and where there are resources. It can also be a listing, sort of a directory type of document that keeps updated. It's not going to be an exhaustive list of everything in the community, but a lot of really important and targeted resources for folks that might be looking for stuff around school mental health. And we're going to be thinking about our audience, right? When we have information for parents, do they know how to access resources? Do our teachers understand how to get students connected to the types of supports and resources they need? And are our teachers and our other audience aware of the needs that we have in our system? And then what steps are we taking to address those on the bigger systems level? Do we need to create some new resources in our community, create some new opportunities so that students can have better access and better health equity? So one tool, so needs assessment happens on a number of different levels. One of those is the large system level, looking at the quality of our school mental health system. So one tool out there is the School Health Assessment and Performance Evaluation System. You'll hear us say the SHAPE system. So this was developed by the National Center for School Mental Health in partnership and with lots of feedback from the field and people with lived experience. And the purpose of this tool is to increase the quality and sustainability of comprehensive school mental health systems through the School Mental Health Quality Assessment. The quality assessment is a free tool that schools and districts can use online at this email or this web address here. So you go in, you create a free account, and then it walks you through the assessment and how to plan from that assessment data and how to they have implementation guides that help your team look at how to better implement the changes that you want to see in your system. The quality assessment provides data on a lot of different levels that can be helpful, and the components that you'll find in this assessment are aligned with our Wisconsin's framework. So you'll be able to understand our system and how this assessment go hand in hand. For resource mapping, again, a number of different tools out there, and this is one resource. This resource checklist provides ideas for resources and supports to include in a comprehensive school mental health resource map. So you can check that one out.
All right, so our third component is mental health referral pathways. So mental health referral pathways are formalized policies and procedures that ensure that students with either emerging or established mental health challenges are identified and referred and connected to the appropriate resources. And this is something that is used across this continuum of supports to ensure that a student receives what they need at any level. So one of the things that's important to remember about mental health referral pathways is that our traditional ways of identifying student need are often subject to bias. So we can use best practices to mitigate those biases that are inherent in our more common referral procedures. So some of those things could include using mental health screening to identify student need, educating staff and families about the mental health referral pathway and how to access it, and just increasing mental health literacy in students and staff so they know how to accurately identify students that might be in need of additional support, and they can really feel confident engaging that student in a supportive conversation. Here we have a tool for implementing your mental health referral pathway. So we have a series of school mental health referral pathways modules, and they include different local examples, some tools, and different ideas for how you can start to develop and improve your mental health referral pathway. So there's a module that addresses those who are just starting to build their referral pathway, and then there's also a module that is geared towards those schools that are really just wanting to hone aspects of the referral pathway and improve it. The next component in our comprehensive mental health system is the Continuum of Supports. So the Continuum of Supports includes mental health promotion, early intervention, and treatment services, as well as crisis supports. So when we think about a continuum of supports, we want to really be looking at that universal level and focusing on a strong universal implementation. So we know when we focus on making sure that we're building a good school climate, that students have opportunities for social and emotional learning, that we're paying attention to educator wellness, that we educate students and staff about mental health and develop their literacy, that we are setting the conditions to have a successful continuum that isn't top heavy. So we want to avoid having too many students that need those more time intensive and costly supports and services. Of course, our continuum of supports is made up of evidence-based practices that are implemented with fidelity. So our continuum of supports in our schools is one part of a larger system of care. So the system of care includes all of the community-based services and supports for children who might be at risk for developing mental health challenges or already are developing. And so these are all organized into a coordinated network where there are meaningful partnerships with families and youth. And the services and supports address the cultural and linguistic needs of the students. So I'll just highlight a few mental health promotion tools. So first we have our stigma reduction toolkit. This is geared towards secondary students, and it includes lessons that can be used in a variety of settings to help start conversations about mental health stigma and start to reduce the stigma in the school. So this also includes a parent component as well as a component for school staff to examine their own stigma and how it shows up in their work. We also have mental health literacy units of instruction. So these units are meant to be implemented in health class, but they could be used in other settings as well. They are aligned to the National Skills-Based Health Standards. So they take an approach of trying to make sure that students have the skills that they need to be healthy. Additionally, we have youth mental health first aid training, which is a general mental health literacy training that's available through our Wisconsin Safe and Healthy Schools Center. And then lastly, our DPI social emotional learning competencies and resources. So these are all aimed at helping schools and districts implement an integrated approach to helping students develop the social and emotional competencies that they need to be successful.
The next component is data. Both quantitative and qualitative data should be collected and reviewed by teams in an ongoing manner to inform priorities and action steps to continuously improve the comprehensive school mental health system. So we use implementation data to assess quality and functioning of our system. So implementation data are indicators of successful implementation of a new program or practice. So examples here could be fidelity measures, feasibility, appropriateness, or that system needs assessment, the SHAPE tool that Julie mentioned earlier. And then we use impact data to measure the effects of those programs, policies, and practices. So this this is demonstrating those long-term effects or changes that occur as a result of the services and programs that we're implementing. And this could be something like SEL screening data, or maybe tracking the number of students receiving and exiting a support program. Data really are the backbone of quality improvement efforts in a comprehensive school mental health system. So one great tool DPI has created is this quick guide, which is intended to assist in differentiating between different assessment tools. So you'll see here, there's the social emotional learning competency assessment, the universal social emotional and behavioral screening, and then more targeted social emotional behavioral assessment tools. So these can often be kind of used interchangeably, and if we're more intentional about when and how we're using these, the outcomes are going to be a lot better over time. So this tool provides some basic information relating to these screening and assessment. It defines each assessment, including both what it is and what it's not. It considers equity, explains outcomes, covers consent requirements, and addresses some of the frequently asked questions that we've been fielding over time. There's also a selection of additional resources linked at the end to help support in that comprehensive planning. So our last component is sustainability. And we know that financial sustainability is important, but we also want to emphasize that sustainability includes non-financial assets as well. So when it comes to the financial piece, we want to consider the creative ways that schools can braid and blend funding sources for those most optimal outcomes. And this braiding and blending can also apply to the non-financial assets as well. So how are we integrating this work into existing equitable multi-level systems of support structures that are already in place? And sustainability also considers the retention of knowledge and skills. So how are we retaining staff, supporting their knowledge and skill base, and providing coaching and ongoing support of their learning, their needs, and even their social emotional well-being? In order for us to be student-centered in our planning, we need to begin really putting staff front and center as well at all levels. And a great example of a non-financial tool for sustainability that focuses on staff is our Compassion Resilience Toolkit. So our team at DPI developed this tool in conjunction with Rogers Behavioral Health. And this is an excellent resource designed for teachers as well as some others in the helping profession. The toolkit's one way that schools can support building staff resilience, particularly during this difficult time. And it's not only focused on that individual resilience, but on really building a compassionate staff culture, that universal level. So the toolkit, it offers information, activities, lots of resources for school leadership and staff to help understand, recognize, and minimize the experience of compassion fatigue, and to really help increase the compassion resilience perspective and skills. It helps participants develop skills in managing their expectations, setting professional and personal boundaries, building and sustaining effective working relationships, and really practicing that real-time and ongoing self-care. It's really important to note that this is meant to be that universal cultural approach to compassion, resilience, and staff wellness. It's not really meant for that intervention for the most burned out staff. It's meant to kind of start building up that culture of wellness. So we've now covered the 6 components of the comprehensive school mental health system. And we invite you now to pause and reflect on your school and your district's mental health system and how that's doing. So which components is your system really what's going really well, what's strong in your system as far as the 6 components you see on the screen? And then also reflect on which component or components your system maybe need a little bit more support or attention for.
Okay, the next point we're going to consider related to comprehensive school mental health is how mental health work is integrated into existing systems. So if we take a look at this graphic, we can see at the top is our equitable multi-level system of supports. And so our comprehensive school mental health system is rooted in the EMLSS, not a separate system that we're trying to build. So schools are really encouraged to leverage existing features of their equitable multi-level system of supports as they apply to academics and behavior as they think about building and improving their mental health supports. So we can see under the equitable multi-level system of supports, we have our academic, which an example of that would be RTI. We have our behavioral, an example of that would be PBIS. And then we have mental health, and an example of that would be our comprehensive school mental health system or the integrated systems framework if you are implementing PBIS. So everything that we do in a school has a point of intersection with school mental health. So let's just walk through an example. Let's say that we're trying to increase reading scores in our school, and we decide that the way that we're going to do that is with a new reading curriculum. So what do students and staff need in order to be able to teach that curriculum, to engage in that curriculum, or to benefit from it? Well, there are a few things. We can see the gray boxes are some of the key elements that kind of underlie the work that makes the new reading curriculum effective. So, students need to be focused on learning. They need to be able to persist through difficult tasks. Teachers need to be regulated enough and able to teach the new curriculum, even when they're running into challenges. So those are examples of what needs to be in place. And in order to do that, we can use different aspects of our comprehensive school mental health system to create those conditions. So if we take a look, for example, at students needing to be able to focus on learning, we think about creating safety, which is part of our trauma-sensitive lens. So that physiological safety, academic safety, social safety. When we think about students having the ability to persist through difficult tasks, we know that's something that our social and emotional learning curriculum or integrated work can address. And then lastly, if we look at, having teachers who are well and emotionally regulated and able to teach the curriculum, even when there are challenges in the classroom. We know that our adult social and emotional learning and our compassion resilience work can help those teachers to build those skills. So we can see that all of these important intersections exist, but if we aren't integrating the work, we have, separate data systems, referral processes, disconnected teams, then we might really miss these connections and these opportunities to leverage our academic and behavioral work to support and to promote mental health, and vice versa.
All right, so what is this fourth key point that we want to convey to you today? Right now, we want to look at that all aspects of the school mental health system is implemented from a trauma-sensitive lens. In fact, all aspects of the school are implemented from a trauma-sensitive lens. So the principles of trauma sensitivity are safety, trustworthiness, cultural responsiveness, empowerment, collaboration, and choice. So what does it actually mean to approach our work through a trauma-sensitive lens? Well, a lens is something that facilitates and influences perception, comprehension, or evaluation. So in a comprehensive school mental health system, the trauma-sensitive schools guiding principles facilitate and influence stakeholder philosophy, understanding, assessment, and action. Let's take a closer look at each of these. So when we're talking about safety, what we're talking about is things like physical, emotional, and psychological safety, which is enhanced through predictable routines, caring relationships, and positive school climates free from violence. Universal programming, including mental health stigma reduction efforts and a focus on social connectedness, increases real and perceived safety between students, staff, and caregivers. What about trustworthiness? Well, students, staff, and caregivers perceive the school system and individuals within it as honest, truthful, and reliable. Schools foster trustworthiness when individuals are treated with respect and cultural identities of groups and individuals are considered assets. We also know how important it is to pay attention to cultural responsiveness. A school cannot be truly trauma sensitive if it's not also culturally responsive. So here, school leaders seek to understand the unique values, beliefs, and behaviors of the school community and apply that understanding to implement practices that adapt to the broad diversity of race, language, and culture. The school community recognizes the history of systemic oppression in education and mental health systems and works to prevent and redress these harms. We understand cultural responsiveness through DPI's model to inform culturally responsive practices. Empowerment is when school leaders provide space and opportunities for students and staff to recognize their own brilliance and shine. By encouraging experimentation, providing opportunities to build mastery, and fostering a growth mindset. The school community uses person-first language and recognizes people with mental health challenges as strong and capable. Collaboration is when school staff trust students and families as experts in their own situations. They listen to what families say about their children's interests and challenges related to mental health and school, and talk with students about how they want to be supported. Staff engage cultural groups in the school community in the creation, implementation, and improvement of the system. And choice. Staff, students, and caregivers have authentic opportunities to collaborate and co-create programs, practices, policies, and procedures of the school and district. Staff engage students in problem solving to promote power sharing and agency. Individual student planning is family-driven and youth-guided. So how can we really use this lens in our work? Well, we have some questions for application. So a group of leaders in the building, a committee doing specific work, maybe around the new reading curriculum, or maybe you're looking at an attendance improvement planning meeting, or it's your PBIS committee and they're saying, how can we be more trauma sensitive? So these are some questions that any of those groups could use to think about how their policies, programs, practices, or procedures that they're looking to implement or they're looking to improve, how could they become more trauma sensitive? They can ask these questions. Does it increase relationships? Does it promote those TSS guiding principles as we had just talked about? Does this support staff well-being and growth? Is this accounting for the impacts of trauma? Does it help build resilience, mastery, and hope? Does it incorporate regulatory practices, which are good for all students and staff, and especially good for students who have been impacted by trauma? Does it focus on the system's impacts on the problem, making sure the system's not contributing to harm? And does it honor the behaviors, beliefs, and historical experiences of families and communities? So those are the 4 key points that we really hope that you take away from today's presentation. Again, those are that mental health includes well-being. We promote mental health in schools using comprehensive school mental health systems. Mental health work is integrated into existing systems. So like an add-in and not an add-on. And number 4, we infuse trauma-sensitive principles into all aspects of the school.
All right, so where do we get started with this work? We know that schools and districts across Wisconsin are already implementing a lot of great mental health resources and supports, and that everyone is really in a different place with this. So a few things to consider when you're thinking about what are my next steps with my comprehensive school mental health system. One thing would be just to take some time to really understand your system. So thinking about something like doing the shape quality assessment to get a sense of the components of comprehensive school mental health and what might be going well and what you might need to focus on in your system. And then also engaging in different needs assessment processes to really understand what's going on in your school, your community, and then talk about shared goals with your collaborators. What is it that we're really aiming for with our school mental health work? Next, you can take a look at our new Wisconsin Comprehensive School Mental Health Framework and the related resources. And you can think about how can you build a team of people? How can you have champions and supporters for this work? Remember to include community partners, go to students and families, and think about how they can contribute to the planning and implementation of the system. And lastly, we just really encourage you to start small. So really focus on identifying and implementing a small change to your existing mental health system, and then monitor its impacts to inform more changes to the system before you fully implement anything new in your system.
So we have just given you a lot of information and resources and ideas to think about. So it's great to take a moment and pause the recording and thinking about what are you taking with you today? What's one piece of information or resource that really resonated with you? What's one thing that you're still wondering about? And what's one thing I learned that I can use right away? And when you're thinking of those things, don't hesitate to contact us. We're happy to talk with you about the various tools and resources and ideas that exist out there. And we're available to have those conversations. So thank you for joining this recording today. And we wish you the best of luck in your work in comprehensive school mental health.